How does audiometry diagnose conductive hearing loss? Imagine trying to listen to your favorite song through a wall. You might hear muffled sounds or some parts missing. That's similar to what happens with conductive hearing loss. Audiometry helps doctors figure out exactly where the problem is. It does this by testing how well you hear sounds through two different pathways: air conduction and bone conduction. In air conduction testing, sounds of different pitches and loudness are played through headphones that sit over your ears. You're asked to signal when you hear a tone. This helps find your air conduction thresholds, which are the softest sounds you can detect through the outer and middle ear. Then, a small device called a bone vibrator is placed behind your ear on the mastoid bone. It vibrates to send sounds directly to your inner ear, bypassing the outer and middle ear. This measures your bone conduction thresholds. If you have conductive hearing loss, the bone conduction thresholds are usually better, meaning lower in decibels, than the air conduction thresholds. This difference between the two is called an air-bone gap. When the gap exceeds about 10 decibels, it suggests that something is blocking or impairing sound transmission in the outer or middle ear. For example, if the air conduction threshold is 50 decibels but the bone conduction is 10 decibels, there's a clear gap indicating conductive issues. A larger gap, such as over 40 decibels, often points to problems with the middle ear bones, like in otosclerosis, where the tiny bones that help transmit sound become stiff or fused. The results are plotted on an audiogram, which is a graph showing hearing sensitivity across different pitches. The pattern of a significant air-bone gap on this graph confirms conductive hearing loss. Sometimes, a dip in bone conduction around 2000 Hz, called a Carhart notch, can indicate specific middle ear conditions like stapes fixation. Audiometry is usually suitable for children over 4 years old, as it relies on their ability to respond to sounds. For younger children, other tests like tympanometry or auditory brainstem response testing are used. These tests help provide a full picture of hearing health. In summary, audiometry diagnoses conductive hearing loss by revealing a noticeable difference between air and bone conduction thresholds on the audiogram. This difference shows that sound isn't passing properly through the outer or middle ear, while the inner ear remains functional. Knowing this helps doctors decide the best course of action, whether that's medical treatment, surgery, or other interventions. Always remember, if you suspect hearing issues, it's important to consult a healthcare professional for personalized advice and accurate diagnosis.